Parkinson's is a life-changing diagnosis that can't be discussed and rationalized in a 5-minute conversation.
More than 1 million Americans have a diagnosis of Parkinson's disease.
I felt scared when I was first diagnosed.
Parkinson's symptoms aren't always obvious, even to the person with the disease.
Lack of coordination, simple things that other people wouldn't necessarily attribute to an illness.
I was holding my toothbrush with 2 hands. I wasn't really even aware that I was doing that.
But we know more about Parkinson's than ever, and people are learning to live full lives after diagnosis.
There's lots of allied healthcare professionals that have the time and skills that can help you optimize your quality of life.
Welcome to the Parkinson's Disease Podcast. Throughout this series, we'll hear from those living with a diagnosis.
There were a lot of logistics that needed to happen to set up a life that could be fulfilling and rich and wonderful and affordable. But we've been able to do that.
We'll talk to the people diagnosing Parkinson's.
How's your sleep? How's your mood? How's your thinking? How's your bowel, bladder, etc.?
We'll hear from a range of different experts who can all play a vital role in improving quality of life after diagnosis.
Maybe that you add a physiotherapist to your medical team, an occupational therapist, a speech-language pathologist, a social worker, an exercise specialist.
We'll also learn that no 2 Parkinson's patients are the same. And so we'll help to shine a light on the many different things you or a loved one might experience before, during, and after a diagnosis. It's important to remember that the information in this series was created for educational purposes only. The Parkinson's Disease Podcast is not a substitute for formal medical advice, diagnosis, or treatment. So if you have questions about a medical condition, please talk to your qualified healthcare provider. Thanks for listening, and stay with us for episode 1. What is Parkinson's disease?